Hey, this is Tali Berman, and today I want to talk about an important topic, which is, and many of you might know that I'm a big advocate for children with autism, but I am equally an advocate of parents with children with autism. And so some of my videos you're going to see on my YouTube channel are really designed to help you have strategies to help your child grow. And some of them are about strategies, approaches to help you as parents not just survive, but thrive on your journey with your child. So here's the topic I want to talk about today. And it all started with a consultation I had with a client that I worked with for many years. And this client was sharing with me that she has a treatment that she's been doing. In her particular case, it was a neurofeedback treatment. And she was really feeling stuck. She was really debating, and it was a very hard decision for her whether she wanted to continue doing this treatment or walk away from it. So I asked her more questions. We investigated more about what were the benefits, what were the downfalls to what she was doing. And basically what was happening is that during this particular treatment, which was neurofeedback, and I'm not saying anything negative about neurofeedback, there are many families I know who have seen incredible, wonderful results from it. But this is sort of my point, was for this particular family, what it meant was that, number one, she really wasn't seeing, she had been doing it for over a year, she hadn't been seeing really huge change or response in her child, that it was a very stressful treatment to do with her child. She could only do it at certain times of the day when he came home from school, which meant that she was completely unavailable to all her other kids. So her kids were watching a lot more TV and on the computer, way more than she felt comfortable with. And the whole combination was just becoming very difficult, really very difficult for her, and she didn't know what to do. So what it came down to, as we investigated further, was that she was staying with it for a variety of reasons, or some of the reasons why it was hard for her to walk away from it was because she didn't want to disappoint the woman who had trained her to work in this way. She was concerned that she was giving up, and she didn't want to be someone who gave up. She wanted to stick something out to the end. And mostly it was about her just not wanting to walk away from something that she felt that she was committed to. So this is a really important topic because what it came down to was her really assessing, is this treatment working for me? Is this treatment working for my child? And is this treatment working for my family? These are the three questions I'm going to encourage you to think about with every treatment you're doing for your child, because here's the thing. There are so many therapies and treatments out there and so many different diets and supplements, and some things are going to work wonderfully for one family, for one child, for one parent, but not so for you. And the opposite is true also. And so my bottom line point is how important it is to really go with your gut, to really, as a parent, ask yourself, is this working for me? And actually, when I was working with a particular mom, we were doing a consultation, I said to her, well, when you imagine continuing with it, how does it feel in your body? Forget our mind that does all kinds of tricks, and we have trips about feeling bad about this, or judging ourselves for being failures, or judging ourselves for not sticking with it to the end. Put your mind aside for a moment. It's just confusing us. What is your response in your body? And she said that when she was imagining continuing with this treatment, she could feel resistance in her stomach. She could feel tension in her shoulders and in her back. Everything in her was saying, I don't want to continue with this. And so really it was about giving her the confirmation and support to do what she really wanted to do. And I know as a parent myself, I've been involved in programs with my younger son and trying to help him with his reading and his focus issues, doing a program. I myself did a program called Brain Highways, where we were crawling on the floor and creeping and crawling every day for 4 months. It was an incredible amount of work. I had seen some wonderful changes, not necessarily in the area I was hoping to, but some wonderful changes. And then the idea was to continue on until his brain was fully evolved in the way that it needed to be to read properly. And after the 4 months, I was done. I was done. I didn't want to do it anymore. I didn't feel like it was contributing in the way that I was hoping it would. And I didn't think that the effort and the stress involved in making it happen outweighed the benefit we were getting. And so this was hard for me. I can totally understand this mother's situation to consider, because I'm a go-getter, to consider walking away before it was fully complete. But I resourced myself. I actually asked my son too, how do you feel about continuing with the program? And he said he's done. And I asked him why he was done. And he said it was too much stress for him. We had really committed. We had done it every single day. It was a wonderful program. He saw some wonderful benefits. But I needed to know that I was done and that he was done. It wasn't working anymore for me. It wasn't working anymore for my child. And it wasn't working anymore for my family. And I feel like making that decision created a huge relief for all of us. And he is continuing to grow in wonderful, wonderful ways. So while you are on this journey with your child, and you have many treatments to consider, and probably many that you're involved in right now, what you can really happen is this uncomfortable, stressful feeling when you're doing a treatment that doesn't feel right for you, for your family, or your child, or considering adding something to your rotation of things that doesn't feel right for you, for your family, or for your child. And so what I'm really hoping to walk away with from this video today is go with your gut. No one can tell you what's right for you. No one can tell you what's right for your child. No one can tell you what's right for your family. It's a different combination of things for every family. It has to be a good match for you. The most important knowledge you can access is what you yourself, what feels to be right. And if you get confused in your mind, check in with your body. How does it feel in your body as you imagine doing this particular treatment? And by doing that, you can avoid a lot of stress, a lot of guilt, a lot of self-judgment by letting go of this push to do something that's not right for you. And vice versa for things that you really want to do. Do you feel excitement? Do you feel pulled towards something? And is it right for you, for your child, and for your family? So bottom line in as a parent, go with your gut. Trust your gut and take the time to really access your gut in making these decisions. So if you're watching this video anywhere other than my blog, I encourage you to hop on over there, www.taliberman.com. That's where all the conversation happens. I'd love to hear what your thoughts are, what your questions are. Do you agree? Do you not agree? What do you want to add? I would love to hear from you and engage with you further on this topic. So great speaking to you today, and I look forward to sending you my next video.